Hello, everyone. Welcome in. We're just going to give people around a minute to join into the Zoom meeting. Thanks so much for joining us today. We'll just give it about a minute or so before we get started. Okay, let's get started, everyone. I can see people are still joining in, so welcome in. We wish to acknowledge the land on which the Toronto Office of Canadian Scholars operates. Since time immemorial, this land has been the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat. Toronto is under the Dish with One Spoon Treaty, in which all Indigenous, First Nations, Inuit, and Métis people, along with all newcomers to Turtle Island, have been invited to share and protect the land in the spirit of peace, friendship, and respect. Hello and welcome. Thank you so much for joining us today. This is a virtual event celebrating the publication of The Politics of Social, Ecological, and Structural Determinants of Health in Canada. I'm excited to be here with you all, and in just a few moments, we'll be hearing from the author of this book, Elizabeth McGibbon, joined by the editor of the Politics of Health series, Dennis Raphael, as well as endorsers Lindsay McLaren and Tari Ajadi. I'm very sorry for butchering that, Tari Ajadi, who we are so grateful to have with us here today. Just going to read out the bios for our lovely speakers today. So Dennis Raphael, PhD professor at the School of Health Policy and Management at York University, is the editor of Social Determinants of Health, Canadian Perspectives, Tackling Health Inequalities, Lessons from International Experiences, and Immigration, Public Policy and Health, Newcomer Experiences in Developed Nations. He is the author of Poverty in Canada, Implications for Health and Quality of Life, and About Canada, Health and Illness, and co-author of The Politics of Health in the Canadian Welfare State, and co-editor of Staying Alive, Critical Perspectives on Health, Illness, and Healthcare. Elizabeth McGibbon, PhD, RN, professor at the Faculty of Science at St. Francis Xavier University, is also the research associate at the Canadian Centre for Policy Alternatives. She published the first books in Canada on the politics of social, ecological, and structural determinants of health in Canada, Oppression, a Social Determinant of Health, and Anti-Racist Healthcare Practice. She is an invited author for 25 chapters in multiple edition critical health studies books in Canada, the US, and the UK. Along with a 3-person led team, she established the National Collaborating Center for Determinants of Health. Lindsay McLaren, PhD, professor, Department of Community Health Sciences at the University of Calgary, has a research and teaching focus on social determinants and political economy of health. She is a research associate with the Canadian Centre for Policy Alternatives National Office. Lindsay has held a CIHR/PHAC/AIHS Applied Public Health Chair Award 2014 to 2019 and received the 2019 CIHR-IPPH Trailblazer Mid-Career category, an achievement for an award that recognizes exceptional contributions in public health research and population. Lindsay is the past president of the Alberta Public Health Association, author of A History of Public Health in Alberta from 1919 to 2019, and serves as senior editor for the Canadian Journal of Public Health. She also serves as co-editor-in-chief for the Journal of Critical Public Health, which is a community nonprofit journal formed following a mass editorial board resignation from corporate publishers. Tari Ajadi, PhD candidate at Dalhousie University and associate professor at McGill University, Department of Political Science, has a research focus on comparisons of how Black activists in mid-sized municipalities strategize to prompt change in policing and health policy. As a British Nigerian immigrant to Canada, Professor Ajadi's goal is to produce research that supports and engages with Black communities across the country and stands in solidarity with Indigenous peoples across what we now call Canada. He is co-founder of the Nova Scotia Policing Policy Working Group, a member of the Board of Directors of the Health Association of African Canadians, and is also a board member with the East Coast Prison Justice Society. Very quickly for everyone, I want to mention that we have a discount code available, as you can see here on your screen on the lower left-hand side. It is TPS2K25, and this will give you 20% off any purchase you make on the Canadian Scholars website. We also offer free shipping within Canada. This coupon code is available for use up until March 19, 2025. So we do encourage you to take advantage of this great discount. We'll be taking any questions from the audience at the end of this presentation, so please feel free to use your question and answer function through Zoom. There should be a Q&A button appearing at the bottom of your screen, and you may submit your questions anytime during this presentation. You can also do so anonymously as well. Lastly, before I turn things over to Dennis, first, I would like to mention that this webinar will be recorded, and we will email it out to everyone who registered within the next few days. We will also be giving away 2 print copies of the book to attendees who will be contacted just after this launch. So let's begin. Please welcome Dennis.
Hey, I'm trying to share my screen, which I'm now doing. I would mention that Ron Labonté is also on the panel, and perhaps when we begin the panel discussion, Leanna will be able to give his background as well.
Yep, sorry I missed that. When my screen is shared, I can't see anything but my presentation. Go ahead.
Okay, so people can see the Politics of Health series in blue. Can people see my slide?
Yes.
Okay, thank you. It's becoming evident that the sources of health, as well as inequities in health, the unfair and unavoidable differences in health outcomes, are primarily due to how resources are distributed among a society's members. These resources include economic resources such as income and wealth, and social resources such as access to social services, healthcare, employment, housing, and food, as well as the power and influence to shape the legislation and regulations that distribute these same resources. Increasingly, attention is being directed to economic and political systems and the transnational global capitalist system and how the making of public policy is embedded within these systems. As most of you attending this would appreciate, this is a far cry from telling people to eat fruits and vegetables, exercise, and quit smoking. This type of analysis looks at the societal structures and processes that determine how public policy enacted by governing authorities shapes the quality and distribution of these resources. Such an analysis is far more useful than discredited approaches that focus on so-called healthy behaviors and lifestyles as the determinants of health. The Politics of Health series looks at these issues. The first 2 volumes in the series were The Politics of Dental Care in Canada by Carlos Quinones of the University of Toronto, who is now at Western University, and The Politics of Health in the Canadian Welfare State by Tober Bryant of Ontario Tech University, and yours truly. In the 3rd volume, The Politics of Social, Ecological, and Structural Determinants of Health, Professor Elizabeth McGibbon of St. Francis Xavier University takes a novel approach towards understanding these influences upon health by developing a 3-pronged analysis of the factors that shape health. Social determinants of health include the now commonly accepted, though little acted upon by governing authorities, factors of housing, healthcare services, food security, living wage, and education, isms of ableism, ageism, classism, and genderism, and geographies of built environments such as segregation, ghettoization, and toxic dump locations, among others. Numerous volumes document the scope of the effects of these social determinants of health upon Canadians' health and well-being. Dr. McGibbon's book extends the investigation of the precursors of health by delving into the ecological and structural determinants of health. Ecological determinants of health are pollution, ecotoxicity, environmental racism, resource extraction and depletion, climate and atmospheric emergency, desertification, deforestation, ocean and soil acidification, biodiversity loss, species endangerment, and extinction. Structural determinants are the less commonly considered factors associated with political economic determinants of health, such as neoliberal epidemics, neoliberal global capitalism, worker unionization rates, commercial and corporate determinants of health, digital determinants of health, colonialism, white supremacy, social murder, necropolitics, and slow violence. Professor McGibbon's wide lens for understanding the determinants of health therefore offers a profoundly new way of understanding the forces that are shaping health and what needs to be done to respond to these forces. Professor McGibbon's work is sure to provoke reflection and discussion and hopefully stimulate action in the determinants of health. And have I stopped sharing?
No, you're still sharing.
Okay. So, what happens now?
I think, Dennis, you have to figure out how you can stop sharing the screen so that Elizabeth can share her screen. It's still up. It's nice to see Mark's.
Okay.
Yeah,
My screen says share, and I'm not sharing.
I think I can kick Dennis out of that. Give me 1 second.
That would be a good idea.
Yeah,
Okay, I don't know
technical
how-
difficulties, it happens.
I don't know how to unshare it.
Yeah, 1 second. There we go. I think we're all good, folks.
Okay.
Okay, thank you very much, Dennis, and hi, everyone. Welcome again. I joined from the beautiful East Coast in Mi'kma'ki, the unceded and ancestral territory of the Mi'kmaq people, a territory covered by the treaties of peace and friendship, which Mi'kmaq, Maliseet, and Passamaquoddy First Peoples signed with the British Crown in 1726. It takes a whole family to raise a book, including my partner for almost 4 decades, Pat Gardner, our 2 children, firstborn Case Eugenie Gardner, and second-born Sophie Margaret McGibbon. These 2 beautiful young humans make me ever hopeful that a just and compassionate world is at hand. The ideas in the book were difficult to piece together in a linear chapter-like way. In our collective on the ground real world, they are a mashup. They're impossible to see, understand, or tackle separately. They always come together in an insistent synergy. Early on in the book, I talk about the overarching area of policy, public policy, institutional policy, and so on. Untangling the policy world, especially public policy, from a critical perspective, naming power, privilege, and calling out the overall public policy realm itself, where neutrality and its magical neighbor, objectivity, are thought to be desirable and even possible. Policy is one of those words like equity and structural that have come to represent a sort of grab bag of special but hidden ideas, like Santa's big bag. We see that lumpy and many-shaped objects in the bag are definitely there, but we don't visibly see what they are or what they mean. Perhaps most importantly, if they're kept hidden, we are in an ideologically safe territory. We don't need to pester ourselves with the messiness and hatred of everyday oppressions. Social determinants is in its own way another grab bag phrase that has taken on the veneer of progressive thinking in some areas. If we sprinkle these words around enough in presentations, policy documents, institutional mission statements, research proposals, and so on, we'll improve. The assumption is we'll improve health outcomes for those who are most suffering. Well, no, if the messy and for some uncomfortable words of oppression are not also front and center, such as social murder, queer and trans hatred, imperialism, capitalism, and so on, then we're back in the lumpy bag where these nasty happenings are hidden away, and therefore not actionable. People and planet aren't at risk or vulnerable, as if they are sort of more prone to damaged health, the way we might be more prone to catching a cold. Or equity seeking, as if these folks are wandering around looking for justice. They are under threat, rather, of capitalist neoliberal policies and governance mandates, along with many new framings of the current policy crisis. Unless we're grounded in critical perspectives about ruling power and privilege, applications of the social determinants are window dressing, social determinants tourism. The ecological chapter dovetails with the social determinants chapter, exploring how the Anthropocene is increasingly framed as the capitalocene, clearly naming the root causes of planetary and damage and the damage of all living things as capitalism. Earth scientist Catherine Yusuf's groundbreaking book, A Billion Black Anthropocenes or None, traces the color line of the Anthropocene, examining how, as she puts it, the grammar and language of geology is foundational to establishing the extractive economies of subjective life and the earth under colonialism and slavery. As Mi'kmaq elder Dan Paul describes, quote, for more than 4 centuries, courageous, dignified, and heroic Mi'kmaq people displayed a determination to survive the various hells on earth created for them by Europeans, with a tenacity that equals any displayed in the history of humankind. It can be overwhelming to come to grips with how these determinants all come together. After I write a book like this, I go through a period of mourning, where all these realities gel together in their enormity. The question for most of us, or on most of our minds right now in the current climate, this past year and these past few months, these past few weeks, given the news, is what can we do now in the face of such need? So in the moment, we're called urgently to bring our work to a broader audience, especially those of us who are in a relatively secure situation who can safely speak up and bring things forward. So as tempting as it is to keep our heads down and wait out this storm, silence is assent. As Pastor Martin Niemöller stated during the Nazi takeover of Europe, and this is a quote from Pastor Niemöller that's becoming more and more circulated in this last month, really. First, they came for the communists, and I didn't speak out because I wasn't a communist. Then they came for the socialists, and I didn't speak out because I wasn't a socialist. Then they came for the trade unionists, and I didn't speak out because I wasn't a trade unionist. And then they came for the Jews, and I didn't speak out because I wasn't a Jew. And then they came for me, and there was no one left to speak up for me. So overall, our groundings in social justice and human rights are seriously under threat, as they were in Niemöller's time. Not in the same way, but there's definitely a threat. So human rights are seriously under threat, under siege. However one might frame this advance, of rights deterioration, I'll call it. Fascism is a prominent framing. It steadily and predictably involves assaults on the labor union movement, climate emergency denial, suppression of the press and the arts, austerity's relentless public policy assaults on the poor, and private, read for-profit, takeover of public goods and services, all for the financial and material benefit of the very few, the 1% that's often increasingly talked about. A group that Graham Scambler, Emeritus Professor in Sociology at the University College of London, refers to as the greedy bastards. The underpinnings of resistance are solidly in motion. The resurgence of the labor union movement in Canada and in other countries, very demonstrable resurgence, is a solid, organized, and successful foundation or template for resistance. Jane McAlevey created a global network of organizers that continues to train and work for workers' rights around the world. As Tom Workman describes, we follow this resurgence of the Canadian left with its openly public foundations in social democracy and socialism. So the public acknowledgement of social democracy and socialism that was once the foundation of Canadian left politics. Alexa McDonough, Ed Broadbent, Tommy Douglas, to name just a few. So moving forward, we're collectively creating classic examples of complex adaptive systems, which seems like a nebulous kind of a term, but these systems are interconnected, interacting, and unpredictable. So building on historic and current resistance movements and creating new ones. Developing comfort with uncertainty is a must for us right now. And I think that's what's so scary. What is it? What's going to come tonight in the news? What's going to come next week? In his book, From Dictatorship to Democracy, which many of you will be familiar with, U.S. political scientist and activist Gene Sharp tells us, quote, "A future of domination, the rule of violence, and popular helplessness," and I underscore the notion of popular helplessness, "is not inevitable. We now have the knowledge needed to block that sad future if we have the will to use it." So I very much look forward to our conversation now with my colleagues.
Yes, so we'll be moving on to the roundtable discussion portion of the event. Before we do that, I will quickly introduce our final panelist, who is last but not least, Ron Labonté. So let me just read that out quickly for everyone. So Ron Labonté, PhD, Professor Emeritus, former Distinguished Research Chair in Globalization and Health Equity in the School of Public Health and Epidemiology at the University of Ottawa. His research is focused on health equity impacts of diverse globalization processes, ranging from health worker migration, medical tourism, global health diplomacy, trade, political economy, and tobacco control, trade and food security, health impact assessments of trade and investment treaties, comprehensive primary healthcare reforms, the social determinants of health equity, health and foreign policy, and global governance of infectious disease and antimicrobial resistance. He is active with the People's Health Movement, has consulted extensively with UN agencies, governments, and civil society organizations, and is an editor-in-chief of the BMC journal, Globalization and Health. So thanks so much, Ron, for joining us, as well as our other panelists. I'm going to hand things over to Dennis, who will be asking the questions for this roundtable discussion.
Okay, I'm going to read the question. I suggest people just kind of jump in. We're now in a very chaotic period where global politics, economics, and policies are incredibly uncertain. How does this book help people to understand these developments? Over to you.
Wondering if I could kick things off here with a brief comment, and then I'm so pleased to be able to be in attendance for this launch. And I will just quickly note that I'm in Tiohtià:ke, here in very, very snowy Tiohtià:ke, the unceded territory, traditionally stewarded by the Kanien'kehá:ka Nation, but a convening place to this day of many First Nations and Indigenous communities. So the chaos that is our collective experience right now, I think, is something that not only does this book directly respond to and presage in many ways, but also offers us a path to think through. I'm thinking about this particularly as it relates to the younger generation or the youngest generation, and a kind of stewardship of deeply complex ideas that, as Elizabeth so kind of eloquently mentioned, are enmeshed in our everyday experience. So a big part of the chaos, and a big part of the chaos that I think those that would seek to divide and ultimately rule us depend on, is the idea that there is nothing to pass apart, that everything happens all at once, that we are simply able to be subsumed by a maelstrom of things happening to us rather than agents in a part of a collective future. And I think that by teasing out how these processes unfold, by teasing out how one might sit in complex systems, how those complex systems are a part of decisions that people make rather than natural forces that happen to us, the book gives readers, and particularly those younger readers, a sense of agency and an ability to start to think through what a world that might be different might look like. And so in that respect, I think it's a really important and necessary contribution. So I'm really pleased to be able to endorse.
Lindsay, do you want to go next? Jump in.
Sure, thank you. Well, thanks very much for the invitation to be part of the launch of this really exciting and important book. It's such a pleasure to be here, and I want to congratulate Elizabeth as well as the series editors and the publisher. As a small part of building respectful relationships, I wish to acknowledge that I'm joining you today from Calgary, Alberta, which is the traditional territories of the Blackfoot Confederacy, including the Siksika, the Kainai, and the Piikani Nations, the Tsuut'ina Nation, and the Stoney Nakoda Nations, including the Chiniki, Bearspaw, and Goodstoney. Calgary is also homeland to the Métis Nation of Alberta, Districts 5 and 6. So thanks for that question. I think the current chaos, in fact, makes the book even more timely and important. I believe many people are feeling a sense of shock and a sense of disbelief and wondering, how did we get here? You know, I hear people saying this makes no sense. But as Elizabeth lays out, the circumstances we're in now are, in fact, a largely predictable consequence of our political economic paradigm of neoliberal capitalism, how it intersects with other systems of oppression, and how it manifests culturally and in public policy. And understanding this, or at least having a frame to understand it, is empowering. It gives us some tools to think about alternatives or ways out. I think that the critical perspective that Elizabeth takes is especially significant in this regard. So the toxic political economy is not an accident of history, but rather is a carefully orchestrated set of practices that many of us are not even aware of, yet which powerfully shape our worlds, including who lives and who dies. And illuminating these usually hidden dynamics, or belling the cat, which I just love as a metaphor in the book, is so important. And I would just highlight that these are not easy concepts or ideas, but Elizabeth writes about them in an incredibly accessible way that brings people in and helps the reader to connect the dots. And I think if we're looking for a way out of this, we need more people to understand and engage with these ideas and perspectives within public health, but also much more broadly. And I think this book will just help very importantly with this. Thanks.
Well, then I'll jump in now. First of all, like Tari, I also kind of am ensconced right now. I'm in Ottawa. It's a very snowy place, and I want to recognize the Algonquin people who are the unceded and traditional guardians of the land, and acknowledge their longstanding relationship with this particular part of the wonderful part of the world. Now, coming in third on the conversation means that basically the other two have already raised all the points I was going to raise. So I will kind of take a slightly different tack. I think one of the important contributions of this book, and why it's important now, is because for those of us who are familiar with the ideas that Elizabeth is writing about, the election, Trump's election, and Musk's and their attempt to kind of radically disrupt the international liberal order was actually fairly predictable, and was well predicted by many commentators in the run-up to November. So it's really the people who are shocked are the ones who really hadn't had an opportunity to read Elizabeth's book before the election occurred. Had they done so, they wouldn't have been so surprised. They would have been equally appalled. One of the things here too is that what the moment we're in right now with Trump and Musk is that it is tearing apart what had been the old international liberal order. It is also kind of eliminating or putting a final coffin nail on what we consider the neoliberal global capitalist period. Doesn't mean capitalism's disappeared, and it doesn't mean that neoliberalism's disappeared, but it's now only going to allow to exist within preferential borders. So that particular period is over, but now we're entering kind of like an older period of downright imperialism. I think we're actually far closer in geopolitical terms to the same situation Europe encountered in 1933 than perhaps Elizabeth would have us more optimistically believe that we're not. I think that we're pretty much in that situation. Now, that's why I think that the approach that Elizabeth takes and the focus on the capitalist system, because the capitalism has a long history of being disequalizing and being ecologically destructive. So this is all that happened in the last 40 years is that it went on steroids with a kind of liberal capitalism becoming a neoliberal capitalism. So understanding these structural forces of political economies that have brought us to this very deeply troubling moment kind of allows us maybe to understand better why we've had this kind of rise of a far-right misogynist, racist, anti-truth authoritarian regimes in many parts of the world. And a lot of it comes down to the gross disequalization and the insecurities that people are facing. So I think that one of the big things that she has done in this particular, in her particular book, with the deep structural analysis. Now, that analysis is not necessarily new. It's been more, though, on the margins of public health concern and certainly public health practice for quite a while. But she brings it convincingly into the public health mainstream. And she conveys all of these interrelated polycrisis issues in a way which is doesn't try to simplify, but at the same time makes it easy to understand, easy to read, and provides a kind of a unifying basis for then saying, okay, what do we do now? Which she's already talked a little bit about, and that could be where we go to next in our kind of conversation. But I think that was really helpful in the book is the way in which each of the ideas in each of the chapters is illustrated by a series of case studies that are taken apart, unpicked, but why, all of this continuous interrogation to show how and why the ideas represented in those chapters, A, are absolutely essential to understanding why things exist and what to do about them, why things exist that are bad and unhealthy and what to do about them, and B, how they are all interconnected to each other, which really deeply reside in a pathological, toxic political economic system that unfortunately we've been living with for 400 years and needs fundamentally to disappear. It for now.
Well, one thing I just want to mention to the audience out there was Leanna and I are in the same place. So I didn't forget to do the land acknowledgement. I just forgot to mention that she and I were in the same place. So, well, we had two other questions, but I believe that one of them was how does the structural and ecological approach taken by this book inform its content? The other one was why did you choose to endorse this book? What particular ideas stood out to you? So you're perfectly free to respond to those, but I also like what Rana just said about what do we do with this? How do we move forward? Because in my graduate class, after, and also in my undergraduate class, after week one, my students say, this is terrible. What can we do? And unfortunately, I frequently find myself saying, I don't know. I don't know what to do. So perhaps we can explore that or anything else that people would like to say about the book, about where we are and what we need to do.
Well, if neither of the other two are going to jump in right away because they're still muted, I will just continue on with the rant that I began with. Elizabeth already touched on that, is that we can't keep our heads down. We need to be able to speak out as much as we can, to be very, in a way, kind of precise about naming what is the pathology of what is occurring right now. And not mince our words. Let's not try to be nice. Let's not try to appease any of the autocrats that are either in process of becoming that way, becoming dictatorial, or are already functioning it that way. We can't afford anymore to be nice. We need to be politically very certain about the positions that we're taking and to name what it is that lies at the bottom of the difficulties or problems or challenges that we're facing right now. But I think the fact that there's going to be some risk involved, because right now we may have certain kind of privileges, the privilege that comes from our academic passer positions, in my case, even also the privilege of age, which you have as well, Dennis, is that, kind of we have less to lose maybe at this point in time because we have less life, less to actually lose going forward. But we need to take those risks because we're coming down to the kind of like, as it were, the finish line. And if we don't fundamentally continue to promote alternatives, and I think that's the key here, is to promote the alternatives. And one of the things I liked about Elizabeth's book is the way in which she brought some of the community empowerment dimensions, which speaks to my early part of my career, to the macro level global capitalist dimensions, because it's at that local level that we really need to build up, as it were, the resiliency, the resources, the alternative models. And a lot of that is actually happening. I think at that point, that's where our activism can be directed.
I'd love to bridge right off of that point, Ron, because I too was struck by the multi-scalar way in which this book is structured, such that, again, that activism, that agency, that commitment to developing alternatives can be so clearly registered by the reader. I think that that's a critical thing because, again, the forces of global capitalism, the forces of imperialism, the forces of racism seek to make the complex very simple. They seek to provide people with a really simple story about winners and losers. They seek to provide a very simple story about who is under threat, who is threatening, who has power, who doesn't, right? And we can see that not only in the obvious in Trump's rhetoric, but we actually see that in a host of different ways, both small and large, in our contemporary political discourse, right? And it is in that simplicity that we find destruction. So I think that number one, an embrace of complexity, an embrace of the kind of multi-scalar ways within which we must resist capitalism, we must resist the forces of imperialism, we must look within our interpersonal relationships, within our working environment, within our communal environment, and of course thinking globally and structurally. these are the ways that we can start to build a meaningful path forward. And I think that the book gives us a lot to chew on from that perspective.
I'll just jump in for a moment around naming, which you've all talked about, naming what's going on, being honest about what's going on. And I'm thinking of January was a key anniversary of the concentration camps in Europe. And there was a survivor, and forgive me, I don't recall his name, an elderly man who was over 100 years old. And so he was talking about some of these kinds of things. And he said that people call this fascism, which it certainly measurably is, isn't it? And what he said also really struck me. He said, we can call it fascism, but we also have to call it Nazism, because there's so many threads that they're so tethered to something that's already happened. And so I found that a very powerful thing to say, and I certainly agree with him.
Well, I'd love to return to Ron's point about this way of thinking being at the margins of public health. This is something that I spend a lot of time thinking about, being situated largely in mainstream public health. So in that space, there's a very strong tendency to be quite reductive and downstream in our thinking. This is a huge challenge. And a structural analysis, if it exists at all, tends to be in the minority, or in the university education context, it's relegated to the periphery as something that's kind of vaguely interesting, placed in courses that are optional or specialization specific. And I think this book makes it so clear that this is simply not tenable, and the field of public health needs to massively step it up if we actually care about the public's health, which is right there in our name. Now, this content is not about adding additional material to existing core curricula in public health. It's a different way of thinking. And I can say this with some comfort as someone who came to this way of thinking quite late. So this was not part of my training or my early career work. It's very much a qualitative shift where once you've got it, you see the world differently. And I believe this is what's referred to as a threshold concept in educational pedagogy. And so with respect to the question, where do we go from here? My mind automatically goes to students and learners in public health as a whole. And I think it is very significant that this book is going to help readers to have this qualitative shift. And there's immense power in that, or at least I like to think there's immense power in that.
Yeah, building a little bit on that, Lindsay, because I agree very much with that. I mean, the strength of the book is partly who it's directed towards, and the way in which it's taking all these huge topics, this huge complexity, and doesn't dumb it down, but narrates it in a way that is, people can see how all the different pieces fit together, and why an analysis of all those different pieces needs to be done, but it actually can be done. And with the illustrations in each chapter, this is how it is done. So in that sense, it is. I think it's going to be an incredibly useful book, certainly in public health schools across the country, if not more internationally. The other thing I think that's useful about it is the need to bridge between, I guess one way of looking at it is that why are people in public health so afraid of social theory? Dennis, this might resonate with you because we did a study on that around, how income was kind of analyzed in Canadian studies on income and health, and how it was just a holding category. It was never actually defined, assessed, analyzed, no theoretical basis behind it. So we still have this problem in public health of looking at methods that become descriptive, that we then assume are somehow analytical if we just sort of put a series of questions in the end and a few little projections of what we think it might mean at the at the conclusion. So I think that what Elizabeth does in this book partly is by bringing together the political economy of health arguments with the social epidemiology arguments, because whether we agree with it or not, epidemiology is still a base science in public health. Not the only science, but it's still a base science. So we need, if we're concerned about future people, kind of future leaders in public health, embracing and being able to basically confront the toxicity of the particular moment we're in, but all the previous moments that came before and the ones that are going to follow, then they need to feel comfortable in terms of feeling that they have their place within some of the traditional sciences of public health, but are able to undertake that qualitative shift that, Lindsay, you talk about. And I think, Elizabeth, your book does that admirably.
Well, before I turn it back to Leanna to answer the questions, I'm going to say to the audience out there the same thing that I say to my students sometimes when I get into this stuff. And that is that this is how I see the world. Now, if you have a better way of understanding the world and what's going on in Canada and what's going on elsewhere, feel free to bring it to me and explain what's going on within that particular framework. So again, what people need to do is to read this and say, does it explain how we got here? Does it explain how to get out of here? If you read Elizabeth's book and you spend 20 years in public health and you think the answer is still exercising, eating fruits and vegetables, and quitting smoking, then great. But certainly that's not where we've come to see the world. So over to Leanna.
Yes, thank you, Dennis. I can see I saw some questions coming in as the discussions were happening. But if you did have a question you want to ask and didn't have a chance to submit it yet, we'll give you the time right now to do that. There's a Q&A button at the bottom of your screen. Can submit anonymously or not, up to you. We'll just give everyone 30 seconds or so, and then we'll pick one or two questions to ask to our speakers. I also want to mention very quickly that if you are an instructor who is interested in reviewing this book for potential course adoption, we offer complimentary digital review copies to instructors. So if you go to canadianscholars.ca, search for the book, you're able to fill out your info. So one of our sales representatives will be in touch. So that's also another way to obtain a copy. Just an FYI for everyone. I'm going to take a look at the questions now, and I see a lot of amazing things coming in here. So we'll pick one or two, and then anyone is free to answer if they feel that so applies to them. Let's see. So there's a question here. From Stephen, and it's specifically asking about some of the content in the book. It said Canada used to be one of the longest lived countries, but now has a lower life expectancy than people in over 15 other nations. Are the reasons for this discussed within the book?
So I can answer that, and my colleagues here can jump in as well. So it's the historical. So what I do is trace the historical austerity measures, the historical turn to the neoliberal policy making that has done that. And so, the for lack of a better word, or this is a word I often use, is just plain mean. So who gets targeted is the children, the kids, the people who live in poor families that become sicker and sicker. So social supports are cut, all in the name of saving money and so on. Well, we more and more know where the money is going. So it's over time, that's what's happened. And one of the main markers the most sensitive marker of the justice in policy making in a country is infant mortality rates. And so we used to be in Canada, we were, and this is in the book too, with some nice graphs too. We used to be sixth in the world in terms of infant mortality rates, and eventually, and now what are we? So it went down, sorry, up and up and up in terms of where we are. So we're something like 31st, 32nd. And so we're approaching equality, pardon the word, with the US. And so it's absolutely traced to neoliberal, for the lack of a better word, neoliberal policy making over time. So you look at this sensitive measure and you can see homelessness and so on, the massive increases in homelessness in Canada. People haven't got the money. We need a minimum wage, and so, not minimum wage, sorry, a living wage. So, it's very traceable. And here's the interesting thing too, and my colleagues will, I'm sure, jump in, is that this has happened regardless of the political stripe of those in power. Now, some are worse than others, as we know through the Harper years, with the terrible outcomes that happened there. However, this march towards the bottom has happened in Canada, regardless of political stripe. So the move away from socialist policies, which big L liberal parties used to have too. So the move away from that towards what we've got now, which is winner take all, dog eat dog. Yeah. Does anybody have anything else to add to that, Tari?
Yeah, just to comment on the kind of overarching nature of this race to the bottom. I think that one of the tricks of our contemporary political system is to presuppose that, in fact, partisanship will meaningfully make a difference when we're not being given meaningful input into policymaking in the first place. Right? So our policy systems, as they presently exist at provincial, federal, and even municipal levels, are essentially preordained for us in a lot of important ways. And we have complete regulatory capture by corporations that would seek to do us harm. We have an incredible impetus and weight towards particular kind of identity markers like nationalism that blind us to the ways that nationalism will be deployed to further degrade the environment, to further degrade our health, right? Like these are pieces of momentum that happen, as Elizabeth said, regardless of who is in power, because again, it is a structure. It is a structure of parties in thrall to capitalism. And I think that we have to think really critically about the ways that we develop alternatives such that they do not become another kind of axis in this race towards the bottom.
Now, there were a couple of questions here that were put in by an old colleague of mine. Hello, Ted. So this is a couple of questions from Ted Schrecker. One of them, which I think is provocative, and I think it's rightfully provocative, is about how many of us who talk about historic Aboriginal title would be willing to give a proportion of our current home property, the value, towards reparations. And my answer to that would be, first of all, is that in addition to what is already being gathered through taxation, which seems to be the more collective way of actually dealing with issues and redistribution of reparation, which is related to the second question about kind of how are we going to protect working class livelihoods, given the way in which they were destroyed under the US democratic, or shall we say, kind of under liberal capitalist to neoliberal capitalist, regardless of whether it's Democrat, Republican, social democratic, or kind of right-wing neocon kind of governments. And I think the answer, at least in part, goes back to progressive taxation, which we gave away in the 1970s and 1980s. And that taxation then goes into the supply of public goods. It goes into massive kind of publicly funded initiatives, into the kind of clean energy alternatives to fossil fuels, ecological reparation, things that would actually employ a whole new cadre of what had been the traditional working class. If we continue with the same kind of concept of what that working class is and what it should manufacture, or how that industrialization should take place, then we're still basically saying that status quo in some way or another, that's just modified in some slight ways, will manage to ensure not just the survival of the working class, but the survival of everyone else. So I think there's a radical remake of how we actually conduct national or global political economies. And the first step on that has to be this massive kind of recapture and making public again the wealth that any kind of economic activity, regardless of under which metrics or which systems it's undertaken, is used for public good purposes.
I'm just going to jump in. I read over the questions and I'll ask Elizabeth, if not, then I'll say it. Proportional representation, is that contained in the book? The potential of changing the electoral system?
Yes, yeah.
Okay, because PR, proportional representation, is really important because not only might it strengthen the NDP, but it actually might move them into becoming a social democratic party and might even help the emergence of a new party to the left. Because in many countries such as Norway and Sweden, there are people who feel the social democrats aren't political enough and they're able to get into parliament. So that was the other question there.
Yeah, and I'll just add briefly to
Yeah.
that, is that if through people are doing beautiful graphics about this in Canada and other countries too. And it's pretty shocking if you just Google that, Canadian election results, proportional representation. It's actually what people want is a lot more to the left than we would think in Canada. It's quite a bit more to the left if we had proportional representation. Hence the resistance to proportional to making proportional representation changes in the way our electoral system goes. What else?
I just want to jump in with our last few minutes that we have here because we are coming up on the 1 hour mark. And I did see quite a few questions about how to obtain a review copy, how to purchase a copy. So this might be a good time to reshare that information with everybody. Just give me 1 second here.
And I just want to shout out to some of the people whose names I recognize, many of which are from 10, 15 years ago.
Yes, I'll also say there have been many, many positive comments within the Q&A section as well. So I'll share those with our speakers after this webinar. But just want to reiterate and thanks everyone so much for attending today. And I want to say a special thank you to our speakers. I know that they've worked so hard to prepare for today and work together to have such a wonderful discussion, a very meaningful discussion. I just want to share with everyone again the discount code that I shared at the beginning of this presentation. So it's located here on the screen. If you visit canadianscholars.ca and use the code TPS2K25, you'll receive 20% off your purchase on our website until March 19, 2025. We also offer free shipping within Canada. I did see a question about shipping to the US. We do ship to the US as well. So if you purchase a copy, we'll be able to send it to you. We also have the book available in a digital version as well, if that's a preference for you. If you are an instructor, if you go to the book's webpage, again, there's a giant request a review copy button. So you fill in all the information about your course, and a sales representative from our company should be in touch shortly afterwards. So again, just want to thank everyone so much again for attending today's webinar. And I hope you all enjoy the rest of your day. And thank you again so much.
So we're all saying goodbye now. Bye,
Yeah.
all.
Final send off. Thanks, everyone.